We have a number of aims in this chapter, but the main drug that we'll be discussing is loperamide, and loperamide is used for the treatment of diarrhea. And as I said in the last chapter, the first thing that we need to do in order to understand any medication and be able to use it safely is to have at least a general understanding of the disorder that is being treated, especially the safety issues around that disorder. So right now, I want you to think about the safety issues of diarrhea. You may know, or if you don't, try to think about the answer to these questions using the information that you do know. What are the main complications that you think can result from diarrhea? What age groups and body shapes are most susceptible to the complications of diarrhea? And how would you know that the person needs to be administered to the emergency room because of these complications? And you were correct if you identified dehydration, electrolyte abnormalities, and abnormalities in acid-base regulation of the body as being the main safety issues of diarrhea. And think about what's happening in diarrhea. A lot of fluid and electrolytes in the person's system are being excreted. Normally, the kidneys are the organ that release most of the fluid, and the kidneys have ways of decreasing the release of the fluid, and they also have ways of adjusting the electrolytes that are released. That maintains the ideal level of electrolytes, and it also maintains the correct pH, or acid-base levels. But if diarrhea is occurring, we don't have as much control over these parameters. So the person will be losing a lot of potassium and magnesium in the stools. They'll be excreting a lot of bicarbonate, which is the alkaline molecule in the body that keeps our blood from getting too acidic. And any significant abnormalities in any of these can result in convulsions and other neurologic symptoms, coma, and possibly even death, especially in susceptible people. So the next question is, who are the people who are most prone to dehydration? Well, the very young and the very old. So infants are extremely prone to dehydration and also respond to a much smaller variation in the imbalances of the electrolytes with the convulsions that could cause brain damage or death of the infant. Also important to note is the fact that obese individuals will experience dehydration much more quickly than non-obese individuals of the same age. And that's because adipose tissue, or fat tissue, has only about 10% water content, while the rest of the tissues in the body average around 70% water content. The way to determine dehydration is to look for these signs and symptoms, including dry mouth, very concentrated dark urine, excessive thirst, and a decrease, what we call skin turgor, which can be tested by pinching the skin on the back of the hand and seeing how quickly it springs back to the original position. A person who's dehydrated will have a decreased skin turgor, or in other words, the spring back to the original position will be decreased. But one important thing about testing skin turgor, you've got to realize that there's going to be less spring back in a very elderly person. So you need to take that into consideration as well. And now that you understand what the most important complication of diarrhea is, I'd like you to predict the answer to this question. What do you think that the primary therapy for diarrhea would be? And you were correct if you said that the primary therapy for diarrhea is to make sure the person is drinking plenty of fluids and having some oral rehydration drinks. Other therapies can be considered only after we've made sure that the person is not in danger of being dehydrated.